explain about angle of femur. So, a critical rotation parameter defined the femoral neck rotation relative to the condylar axis, essential for gait mechanics, hip stability, and surgical planning. So, in that we have to see how the angle of torsion affects the femur. Next, what is a femoral torsion? First of all, we will learn about what is a femoral torsion. Now, the angle of torsion is a femoral version is the angle between the axis of the femoral neck and the transcondylar axis of distal femur. It is measured or it is seen in the transverse plane, reflects rotational alignment of the femoral proximal femur. In each individual, it varies from degree to degree. Like in newborn, anteversion at birth at 12 degree, and adult average normally 15 degree. Typical anteversion range 10 to 20 degree, and at the lowest through the gait and growth they are 5 degree. Anteversion decreases with age from 12 degree to at the birth at 15 degree in adulthood through the skeleton maturation. Now, what is anteversion and retroversion? So, anteversion are the axis point forwarded relevant to the condyle, which is angled into 10 to 20 degree, causes internal rotation of gait, common in children. Now, what is retroversion? Neck of the axis point backward relative to the condyles, and angle between is less than 10 or negative, cause external rotation of gait associated with the hip management. If we see the clinical significance, version type directly determines resting the rotation and influence the gait pattern, joint loading for injury risk. Now, if it is increased anteversion, what will happen? It will happen like gait presentation in towing, W sitting posture. Range of motion will be increased and external range of motion in internal rotation will increase and external rotation will decrease. This anteversion can be seen in common 3 to 8 years or cerebral palsy. Now, what if it is decreased anteversion and retroversion? Then what will happen? Gait presentation will be out-towing and lateral foot progression. Range of motion of internal rotation will decrease and external rotation will be increased. Then developmental changes at birth, and then early childhood, then adolescence and skeletal maturity. All the criteria will change the functions of femur. Then how we can see the femoral torsion. For that there are many techniques. In this PPT I have mentioned CT scan, MRI and clinical examination. From CT scan we can see the angle of the femur, how it's stored. From MRI also we can see, and clinical examination. For clinical examination we can done by Krug's test, prone hip and internal rotation, external rotation examination. Then what is the clinical significance or clinical implication for the torsion of femur? For that, gait and function, joint pathology, surgical planning. These are the key ways what can be assessment, and thank you.